Good day, this is Swati Priya, counseling psychologist and expressive arts therapist. I'm going to talk to you about how storying can be used as a modality in the process of de-addiction. So when we work with clients, there's a methodology in which we can enable them to create stories and narrate it, which we call as storying, the process. Creating stories is generally we give them that space where they can think about, use their creativity, get in touch with their innate skill of creating stories, where the client introduces a main character, talks about the goals of the character, the strengths, the hindrances, obstacles the character faces in order to reach the goal, and what sort of problem solving strategies and coping mechanisms the character uses, and what is the output, what is the final output of the story which they have created. So this helps us to understand what state of mind the individual is, what is the individual thinking of. Some people might get stuck in between when they need to set a goal, or just to think about the strengths. So the main character generally is a projection of their own selves. We have a discussion about it with clients. After a period of expressive arts therapy intervention with that particular individual, we give this activity. In our clinic, we do this activity of recreating the life story now. So it would definitely be a very different story after the intervention, where the character is able to put in more creativity after getting in touch with themselves about having that awareness about where am I lagging, to work on the lag and create a new life. And it is definitely possible, is something that we insist, and we put it strongly in the mind of that individual, and make them believe that it is possible. That hope and self-inducing self-belief makes the change, and it can create a lot of miracles in cases of addiction. Thank you.